Is phlebitis dangerous and life-threatening? It's a question I get asked a lot. I will explain why yes, phlebitis can in some cases be dangerous and life-threatening. I will also cover what it is, what causes it, what it looks like, what you should do if you think you have phlebitis. My name is Dr. Haroon Gadraj, Director of the Vein Care Centre, helping you find freedom from unsightly and uncomfortable veins, as well as veins causing health problems. Now, if you're new here, make sure you click that subscribe button and all the links in the video description box below. So let's get started, and please stay to the end, where I will share with you the 5 things you should know if you think you have phlebitis. Phlebitis is an inflammation of the vein. The vein is red, hot, and lumpy. The lump is usually tubular in shape and it's tender to touch. It may throb and walking may be painful. The cause of phlebitis in the leg is most often a clot in the vein just under the skin. The clot may disperse and the phlebitis then gets better, but sometimes phlebitis is very serious and the condition may become dangerous. When specifically talking about phlebitis in the leg veins, there are certain risk factors that increase the chances of a blood clot forming. They are obesity, smoking, pregnancy, immobility for long periods, the presence of varicose veins, some oral contraceptives and hormone replacement therapy, certain medical conditions such as cancer and some blood disorders. In the case of leg vein phlebitis, you may not have any symptoms at all, but if you do, they generally tend to be pain, sensitivity, redness and bulging of the vein. Now, as you can see in this photograph of phlebitis, the skin over the vein is often discoloured, but sometimes there may be nothing to see, particularly if the vein is just a little bit deeper under the surface of the skin. Now, the patient in this picture had quite a lot of tenderness, and I performed an ultrasound scan which confirmed that there was clot in the vein, and I prescribed blood thinning medication. Now, in most cases, phlebitis does not usually result in serious complications. However, if the clot in the superficial vein is very extensive, and if it involves an area where the superficial vein and the deep vein come very close together, that's usually in the groin or behind the knee, a deep vein thrombosis, a DVT, can develop. Sometimes people are completely unaware that they have a DVT until they experience a life-threatening complication. The most common and serious complication of DVT is a PE, a pulmonary embolus. A PE occurs when a piece of the clot in the leg vein breaks away, becomes loose, and travels to the lungs, where it blocks blood flow to the lungs. Now, symptoms of a PE, when they do develop, include unexplained shortness of breath, chest pain, coughing up blood, a very sharp pain when taking a deep breath in, shallow breathing. Sometimes the person with a pulmonary embolus becomes lightheaded and may actually collapse. You can also get a fast heart. You can get palpitations with a pulmonary embolus. Now, if you think you have phlebitis, you should see your GP and request a scan. If the area of redness, lumpiness or tenderness is getting bigger, if it's near your groin or if it's at the back of your knee, these two regions where the superficial veins are very close to the deep veins, then phlebitis may be near a deep vein and you may be at high risk of a DVT. Request a scan and insist that it is done urgently. Now, at the beginning I said I would tell you 5 things you must know about phlebitis, and here they are. Phlebitis is not caused by an infection and antibiotics are not required. It always amazes me that even in 2021, people with phlebitis are still prescribed antibiotics. Phlebitis most commonly affects the leg veins, but it can occur elsewhere, and it usually causes swelling, tenderness and redness along the vein. Less common sites include the arm and chest veins. Now, to accurately diagnose phlebitis, you need a duplex ultrasound scan. That's really the only way to be absolutely sure, because conditions such as cellulitis can mimic phlebitis, and so confirming the correct diagnosis with a duplex ultrasound scan is essential, and it ensures you get the right treatment. As I've said, the fundamental problem causing the inflammation in the vein is clot formation, which can spread to the deep veins, causing a DVT. And this then can break away and go to the lungs, a pulmonary embolism. Many experts, in fact, suggest that the term phlebitis should be replaced by the term superficial vein thrombosis, because this term more accurately describes the potential for DVT. The duplex ultrasound scan should not only check the area that is painful, but both legs should be examined for a possible deep vein thrombosis. But that's because when people have phlebitis, they're in a so-called hypercoagulable state. That's a state in which the blood is more sticky, and that means that clots can develop elsewhere in the body, including the deep vein of the other leg. Now, thank you for staying to the end. In the description box, you can find a link to my blog, which has even more information on the subject. I look forward to seeing you in my next video.